kind of odd thing about this time of year is the heaters can get a little over enthusiastic. A little bit. I do apologize for the temperature. We are keeping it a little more on the roasty side. So we are doing an examination here with primarily the face. Is that correct? Wonderful. My name is Dr. Calliope, and I will be taking care of that for you. So let's go ahead and just go over real quick what exactly that exam entails. Let me just grab the marker. And first, we have the areas that we are going to be primarily focusing on. We have the skin and hair. We have the sinuses. We have the lymph nodes, eyes, ears, and nose, mouth, and throat. As far as the main techniques that we're using, we're going to go along with the classic 4 manual diagnostic techniques. This is inspection. We have palpation. We have percussion. Direct percussion, more specifically. And we have auscultation, which means listening. This is with the stethoscope. So, this is mainly what we are going to be doing. Areas of concern. And this is our techniques right here. Any questions at all? Alright, let's go ahead and get into the exam. So, for the purposes of this examination, do you mind if I touch you? Wonderful. I'm going to get in real close here. And I'm going to start with inspecting and palpating your face here. And we are going to look for all kinds of abnormalities. Looking at the symmetry, for example, of your face. Looking at the skin color, texture, pigmentation. Looking for lesions. Looking for just anything out of the ordinary. So I think to get a better look at what's going on here, just gonna grab my magnifying glass and my light. There we go. And we'll take a little peek at everything. So just stay still for me. Was there anything in particular you had a concern about? Okay, good to know. Do let me know if at any point you recall anything. If there's anything you think of. Just take a look at everything. Got a little bit of light. Got a little bit of magnification. Good. Okay. I am going to use the little pick end of this bamboo comb just to help me guide myself through a few different areas. So, for example, we have the eyebrows here. We're focusing on the integumentary system. This is the hair, skin, and nails. So I'm just making sure the eyebrows are intact. The eyelashes are as well. Good. We're going to take a little look through the hairline. We're not going to go for the whole shebang. So we're focusing on the face, but this part arguably is part of it. Around the ears here. Good, right around here. Okay, and around in here. Had any issues with your scalp or hair? All right. Good. We're gonna go a little bit back behind, or around that mastoid process area. Just tracing around the contour of the ear. Good. Good. That looks good. And I'm going to do a little palpation here. So I'm just going to feel around. Let me know if there's any pain or tenderness in any of these areas that I'm pressing in. Good. Along the nose. The eyebrows. We'll just get around the orbit here. We'll do a little bit of a more in-depth look at your eyes in a bit. Around the nose, the mouth, chin, jaw. Any pain in the jaw here, or perhaps even in the temple? Right. Just gonna take a look. Feel the muscles here. Master down here, temporalis right here. Good, okay. Just jot that down real quick. Excellent. So let's bring out the stethoscope. We are going to do some auscultation with the temporal and carotid arteries. So I'm going to start right in here and just going to have you stay still for me. Listening to the artery, the other side. And for the carotid, I'll need you to do a little bit of a special breathing pattern for me. But temporal's pretty easy. So for the carotid, I am going to just have you take a deep breath in and then hold the breath so that I can listen to the artery without hearing the flow of air in the trachea. And exhale. Inhale. And go ahead and let that go. Good. So let's do some palpation there. I didn't hear any issues with the blood flow, which means it would be safe to do a little palpation here. I'm going to feel one side at a time and just get the pulse here at the temple. Carotid artery here. Just feel the strength and the rhythm. If you had any lightheadedness or headaches or any shortness of breath, tight feeling in the chest. All right, very good. Now for the sinuses, we are going to do some palpation and then we're going to do the direct percussion. So for the palpation, I'm going to be pressing in on these areas and I'll just have you tell me if they're painful at all. Of we've had a smidge of construction flanked by woodpeckers today. So if you hear a bit of knocking, it's one of those two. And now the ethmoid sinuses here. Good. And the maxillary. Yeah, good. So direct percussion means that instead of using a barrier like my hand, I'm going to be directly tapping on the skin. So I might be doing something like this or like this. Tapping here, and this can accentuate any issues here. Any pain, tenderness. Okay. Go. All right, good. That's good. If there were any inflammation or issues, then you likely would have felt that pretty quick, huh? Yes. So let's go ahead and do the lymph nodes. I'll start at the back of the head and work my way forward. Right here at the hairline, just because we're already here, I could focus on the facial nodes primarily, but what's a couple extra sites? Occipital. Post-auricular behind the ears. Pre-auricular in front of the ears. We have the parotid gland right down here, a little bit below. Jugulo-digastric. Submental, submandibular, anterior cervical, posterior cervical, deep cervical chain, and supraclavicular. Good. Okay. No distension in any of those. Have you felt any sort of movable or immovable lumps around in these areas? Okay, very good. Likely not fighting off anything. The eyes. We are going to be taking a little look at the eyes here. So I'm going to get real up close and might be bringing that light back in. Checking out little landmarks here. So we have the lacrimal glands right in here. We have the sclerae. We have the pupils, 1, 2, and we have the conjunctival tissue, the eyelids, the iris, right there, good. So I am going to lift your eyelids up, and I'm going to have you look down so I can take a look at that conjunctival tissue. So I'm going to pull up, you look down. Good. Good, good, good. Okay, and now I'm going to be pulling down, you look up. Right. So pulling down and you look up. Good. Excellent. So let's grab the light. And we're going to test pupillary response, as well as just getting a better peek at everything. So if you could just look right here at my nose. Good. There we go. Okay, just keep looking right here. Good. And once more. Good. Then other side. Keep looking right here. Don't look at the light. Just keep looking at my nose. There we go. Good. Good. Alright, so let me just get in a little close and personal. And we're going to look at the eyes. And I'm not going to be shining the full force of the flashlight right at your eye. That would be a little impolite. Yes, I'm just going to get some little glances or some indirect light. And I don't burn out the retinas. Good. Let me know if this is too much. Okay. And right here. Good. Right. Right. Okay. Good. Okay. Good. There we go. Excellent. Now I'm going to have you follow some directions for me so I can get a better look at the rest of the eye. So I'm going to be shining the light here, but I'd like you to look up. Just look up for me. Good. And look down. Good. Look to your left. That's my left. Good. Look to your right. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. Good. Look to your right. Good. Look to your left. and a look to your right. Good. Can you look right up here? That upper corner. And can you look right up here? Good. And right down here. Excellent. And how about right over here? Good. Okay, so let's go ahead and just put that down real quick. So I'm gonna have you just follow my fingers here. They come down, down, down. Good. Back up, up, up. Good. And to the side. Good. And to the other side. And the other side. Diagonally up, 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 right up here. Good. Diagonally down, diagonally down, diagonally down. Good. And up, 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 right up here. Down, 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 right down here. Very good. Okay. Any pain or feel like there's any restriction in movement at all? Okay, very good. Let's take a peek at the ears. So, when I was getting a little look at the hairline, the ears didn't have anything out of the ordinary. And I got a look behind the ear as well, and that looked clear, which is good. Just grab the otoscope. And we'll take a little peek inside of the ears, alright? So, from here, we can just insert the otoscope, and then we'll have a little look at the ear canal. So, here we have the canal itself, and at the very end, marking the middle ear, we have the tympanic membrane. That is our little barrier. Yeah, that's also called the eardrum. So we get a good look at the start of the middle ear as well as the external ear. The ear canal is actually part of the external ear. That's not quite, it's internal, but it's not quite the inner ear necessarily. Right? The other side. The tympanic membrane here is supposed to be what's called a pearly gray color, and it shouldn't have any deformations, perforations. It should be fairly flat with no bulging. And there are two phenomena that I can look at here, that I can note. We have the cone of light, and that's the reflection of the little light on my otoscope. And we have the tip of the malleus, or the hammer. We can see that little guy, and we're good to go. The ear canal itself, we mostly want to check for impaction and irritation, signs of infection, drainage, things like that. And that looks all good. Let's just go ahead and note that down. Let's take just a little peek at the head while I'm here. I'm I'm going to be doing some palpation here. Nothing too crazy. And then we'll get to the nose, mouth, and throat, which is the last part of our exam. Any pain or tenderness with this? Okay. Right in here, right in the back here. Good. So, let's see. I need my tongue depressor, my otoscope. That should be it. My lift light. There we go. That should be it. If I could have you just tip your head back so I can look inside the nose. I'm going to get close with the otoscope, but it's not going to go in the nose. There we go. Good. Oh. Any issues with breathing? Snoring, congestion, postnasal drip, which is a runny nose. Good. Septum looks midline, no perforation. Looks good. Right, let's take a little look with the light first. Oh, we have the tongue, the teeth, the hard and soft palate. I might get a better look. A little bit later, we have the floor of the mouth, the buccal mucosa, salivary glands, this, that, and the other. And then I'm going to have you just lift your tongue to the roof of your mouth. Good. And if you could stick your tongue out as far as you can, that helps to flatten the tongue. Okay, can you say ah for me? Good. And not seeing the tonsils stick out. The throat wall looks good. Uvula's midline. Right. Do you have any issues with swallowing or your voice at all? Perhaps some hoarseness? No. Okay. Very good. And do you have your tonsils out? Were those taken out when you were younger at all? Okay. Good to know. So that is going to conclude our examination today. Did you have any other concerns? Anything you think maybe needs a second look at all? Alright. So I'd like to thank you so much for coming to my office. I'm going to sign off on your chart. There we go. And that'll be it. I hope you have a whale